sinus? What are these little air sacs, these little air cells here? That's my sinus, that's correct. What is this space here? Lateral ventricle. Yeah, that's the lateral ventricle.
Do you want me to do the thing that I did before?
Yeah, that'd be great. This is running through the notch in the tutorium. Remember the tutorium cerebelli? Midbrain runs through it. Deep to the tutorium here is the beginning of the cerebellum. So this has to be a shot that's lower than this. Right here. This structure right here. Internal caps. What is this going to be right here, right here? Yeah, the right left bounce. So what is this going to be right here? Right nucleus, that's correct. I asked about this already, this dark vein. Corpus callosum. This is part of the corpus callosum back here as well. Remember, it's longitudinal structure. Back. What lobe is this right here? Temporal lobe, that's correct. Intermediate mass. Who said intermediate mass?
Emily.
Very good.
Do you like being called that? Yeah.
What is this right here?
I have a cousin, so it's fine.
Dr. Pelusa, what is this little area here? What? Third ventricle, that's correct. Alright, what is this structure right here? Say it. The external auditory canal, part of the other here. Where does this structure go? What are these little bright structures here? Choroid plexuses, that's correct. This is a better view now. You can see the choroid plexuses real nicely. What is this structure here? Corpus callosum.
see who's gonna miss it again.
Great. I like that.
Oh, what,
One toward the bottom, like middle-ish one now, where you see the optic nerve. Can you see where the optic tracks would be, or you can only see the optic nerve?
No. Alright, so what are these two structures here? Something looser. What's that?
so the false cerebri, you can see that better on the model.
Was that what it was? 'Cause I was thinking. Not that.
This muscle there. Here, practice.
Thank you.
You're very well done. Yeah.
What is this structure here? What nerve innervates this muscle?
That's the tongue so hypoglossal.
Hypoglossal nerve.
What kind of scan is that, Dr. Parker?
This is one of these three-dimensional scans. What is this structure here? That's the optic nerve, right?
Wasn't that a nerve? That was something.
It was. No, maybe it wasn't on the other classes. That's not a problem.
I think. Ours has a different university. We had the practice. You didn't want it.
What do you see a little piece of right here?
No.
The lens. What do we call this area back here? Posterior segment, right?
It was a program.
Yeah, really.
Hey, you're already in the test now. Can you talk to us?
Okay. Make sure you know your cranial nerves like the back of your hand.
In this class, well, we're all about the cranial nerves here.
It's really wide. I promise I can see you without getting that bruise. It records from like door to
Okay,
door.
so what cranial nerves carry autonomics? Sorry. All right, 37, 9, and 10. What autonomic fibers does 7 carry? Sarah. What autonomic fibers are carried by 7? To what? Submandibular, sublingual gland, and the lacrimal gland. The lacrimal gland. All right.
Same.
The parasympathetics carried by 9. Vasopressin. What do they provide innervation to? Parotid gland. What cranial nerves provide innervation to the tongue?
Hypoglossal and glossopharyngeal. No. Facial.
All right, so hypoglossal provides motor.
Yeah.
All right, sensory innervation is going to be
Oh, facial.
facial anterior 2/3
cranial nerves move the muscles used in speech?
That's also no. That's no.
I should say the muscles, the vocalis muscle that moves the vocal cords.
Facial. No.
Vagus.
Oh, okay. Okay. I don't remember.
Okay. Now, you not only need to know the functions of each cranial nerve, but if there's a palsy of a cranial nerve, be able to describe what deficit would result. For instance, if you had a palsy of the oculomotor nerve, name 3 findings you would develop. Ptosis. Name 3 symptoms. Ptosis, what else? A symptom.
I know. I was just saying that.
Well, lack of accommodation, what kind of symptom would that result in? Blurred vision. Diplopia, what else? Photophobia. In other words, you'll have an inability to constrict a response to light. So that's photophobia. So I may give you a cranial nerve deficit, and you have to tell me what type of symptoms that you would develop. Know your autonomics. Know your autonomics. So, let me ask this question. All organs innervated by the parasympathetic nervous system have what type of receptors? Muscarinic. Whereas organs innervated by the sympathetic nervous system have what type of receptors? Not nicotinic. Adrenergic. Okay. So, sympathetic postganglionic neurons release what neurotransmitter? Sympathetic postganglionic release what neurotransmitter? Norepinephrine. Okay. Now, all postganglionic nerve cell bodies have what type of receptors? All postganglionic. Nicotinic N. Nicotinic N. What is the name of those cellular structures in which the neurotransmitter is bound by a membrane?
Can you repeat the question?
Okay, what's the name of that subcellular structure in which you have membrane-bound neurotransmitter? Synaptic vesicle. Synaptic vesicle. Okay. What type of neurons are sympathetic preganglionic in terms of their neurotransmitter release? They're cholinergic. They're cholinergic. Now, let's talk about the sympathetic innervation of the radial smooth muscle of the iris. Sympathetic innervation, radial smooth muscle of the iris. Where does the synapse occur within that pathway? So the radial smooth muscle of the iris is a structure located above the diaphragm.
So it would be on
It's a sympathetic pathway, so it's going to be within the sympathetic trunk. Right? Does that make sense?
Yes.
On the other hand, if I were to say the intestines, that would be the prevertebral ganglion. What you need to be able to name me all 3 prevertebral ganglia. That's the terrapain, right? What do you call? Now remember that preganglionic axons that snaps within the prevertebral ganglia. Those axons bypass the sympathetic trunk and become part of a nerve that travels to splanchnic. Yeah. In other words, let's suppose you have a preganglionic axon that's providing innervation to a structure below the diaphragm. Okay. It's going to enter into the sympathetic trunk, then bypass the trunk. And these axons will join together to form a pathway to the prevertebral ganglion. And that
bundle of axons that then travel to the prevertebral ganglion and form the splanchnic nerve, or one of the splanchnic nerves. Does that make sense? Okay. So, you know, with most of this, if you can draw out that one diagram where you have all the different scenarios, then you'll be fine. Make sure when you do your cranial nerves, make sure you know, okay, I might ask a question like, okay, let's say there's a lesion of the left optic tract. What type of visual field deficit do you develop? A left homonymous hemianopsia, that's right. But be able to draw it. So be able to draw that pathway so that you can show, so you can support your answer. Okay? Just like if I say, let's suppose you have a brainstem stroke that involves the left hypoglossal nucleus. In which direction does the tongue deviate? To the same side of the lesion. So if it was on the left side, it would deviate to the left. Okay? But again, be able to draw out that hypoglossal pathway, both upper and lower motor neuron. What's that? Homonymous? Like homonymous hemianopsia. Right, you would do something like this. You know what you can do is you can do this. This would be the thalamus. Go like this, and this would be the occipital lobes back here. And what you simply do is you take the nasal fibers like this, where the nasal fibers cross. Whereas the fibers from the temporal half of the retina remain ipsilateral. And then if you continue pathway down this. But if you can draw this pathway, then it's easy to figure out what type of deficit we're developing, regardless of where the lesion is. Okay? Make sure you know your facial nerve, both upper and lower motor neuron innervation. There will be likely pictures of people who have problems. Okay? And you'll have to cite what type of problem it is, whether it's a facial nerve palsy, whether it's upper or lower motor neuron, and be able to support your answer. Tell me why that's the answer. Okay? Oh, that's what, those are short answer questions. When I ask, okay, take a look at this picture, tell me what type of deficit the patient would develop and why. So you draw your pathway. Okay, I'll look at this patient with the facial nerve deficit. Is it upper or lower motor neuron? Okay, tell me why. Draw your pathway. Okay. What do we call that upper motor neuron pathway that extends from the primary motor cortex to the cranial nerve nucleus? What kind of track is that? Cortical bulbar. That's correct. So remember that with the hypoglossal nerves, the cortical bulbar tracts are crossed. Whereas with the facial nerves, the upper motor neuron innervation is bilateral. At least to the upper face. The lower face is lost. Does that make sense? Does everyone follow everything I'm saying? Okay. In other words, you have to know neuro really well. And it's not just for this class. It's like for everything you do after this. If you go to nursing school, you can have physical assessment where you have to do a physical exam, a neurologic exam, and you have to know all 12 cranial nerves so you can test for them. When you do patho, okay, you're going to see a lot of